Hello, my name is Juliet Chavira and I'm gonna talk about diabetes. Did you know that more than 25.8 million of people in the United States have diabetes and more than 7 million of that people doesn't know that they have it? This is a very important thing to talk about because diabetes is not affecting our young people. I want to talk about the main factors of this disease, and those factors are the risk factors and prevention, the types of diabetes, and finally the consequences that this disease can have in our lives. Okay, I'm gonna define diabetes to understand better this topic. So diabetes is a metabolic disease that affects the functioning of our organs, and the most affected organ is kidneys. Okay, diabetes is when glucose is high in our blood and is not absorbed in the cells where it's supposed to be. Okay, the risk factors that we have for diabetes is the first one is genetic. Most people think that diabetes is heritage of our parents, and it's not like that. It could be most important the lifestyle that they give us in our childhood. We can see what they are eating or if they are exercising or not, and certainly it can affect the genetic, but it's not the predominant factor. We can take action. We can take action about it, and we can prevent it. Prevention, it's the next thing. This is having a good diet, a balanced diet. This means we have to reduce the consume of simple carbohydrates, right? And this means all the sweet stuff, like candies, chocolates, pastries, cakes, all that stuff can help the development of diabetes. And the other thing is exercise. We need to exercise to reduce the possibility of obesity, which is a main factor to develop diabetes. And exercising, we can, if we already have diabetes, exercise can help us to in the treatment of this disease. Okay, the next thing that I want to talk, it's about the types of diabetes. The first type is pre-diabetes. This means that we don't have the disease, we are not diagnosticated, and but we have a high levels of glucose in our blood. This means that we are on time to prevent this disease. It's like an opportunity to change our lifestyle, to exercise more, to control our sweet things, and to be healthier, to prevent to develop the next type of diabetes. And we can correct these numbers with our lifestyle. The second type is type 1 diabetes. This is also called juvenile. It's developed in people under the age of 40, and it's the lack of insulin production. They don't have any insulin, and they need a treatment. They need to be getting insulin during the day and get medications for this condition, and it's a lifetime to use these medications. The next type is diabetes type 2. This one is it's more frequent in people older than 40 years, and it's not necessary with the requirement of insulin. It needs medication, but it's not it doesn't mean that it has to be insulin at certain times during the day. um, Diabetes type 2, it's when we produce insulin, but this is not going to the place that it should be going, so the glucose in blood is getting high either way. um, we need to maintain control of uh, of the numbers of our glucose in blood in order to prevent uh, any consequences like amputations or renal complications. Okay, the first one, amputations, it's because with the high glucose, it reduces the sensations in our body. So when we get hurt, we don't feel it, and our cicatrization or the coagulation of our blood, it's lower than usual. So when we get a wound in our feet, we are not gonna notice, and it's not gonna get better, and it's gonna be contaminating all that part, so it can take us to the point that we need an amputation. Renal complications, it's because glucose damage the cover of our kidneys, and for this reason protein is getting in, so it can produce insufficiency, renal insufficiency. The economic factors, it's this disease is expensive. We need to monitor our glucose several times a day, so we need to buy the glucometer, and we need the strips to run the test. We need to buy food with lower sugar on it, with sweeteners, and this is expensive. Okay, we absolutely don't want to get this disease, so we have to take precautions. We need to be prevent. We need to change our lifestyle. The 3 points, the summary of this talk, is that prevention is always the best and safest way about diabetes. If we already have diabetes, it is very important to maintain control over it, to prevent the consequences that we can have, and we need to reduce as much as possible the complications. Finally, we can say that the diabetes, it's a very dangerous disease that can take us, if we don't control it, it can take us until death. And it's important to change our lifestyle. It's important to change the lifestyle of our children, and in this way we can have a better life, a beautiful and healthier life. And just remember, we are what we eat. Thank you.